Hi, everybody, and welcome to the webinar today. The webinar title is Towards Future Readiness, Measuring Health System Resilience. It's episode 4 of the Emma webinar series on health management in action, fostering health system resilience. And this webinar is co-financed by the European Commission, the EU for Health Programme. I'm George Valiotis, I'm the Executive Director, and I'll be facilitating today. So just a little bit about Emma before we get started. I can see in the audience, many of you know us quite well, and it's great to see you here again. We have a vision of excellent health management for a healthy Europe, and we do this by supporting the spread of knowledge on effective health management, like today in this webinar. We'd like to do that always by our values of excellence, quality, inclusiveness, relevance, and respect, and I hope you feel all those values today. And to tell you a bit more about us, we're really the only membership organisation in Europe that brings together the full health management ecosystem. We are a recognised, respected amplifier of best practices in the evolution of health management, and we like to provide an environment where evidence, challenge and experience are valued and complex debates on current topics can take place. So again, to that note, we hope you feel that today, and I'd really invite you as an audience to engage and challenge, and I hope what you'll see today is a very good quality presentation that has all of these values and principles. I think several of you in the audience already are an Emma member, but if you're not already, I'd really encourage you to check that out. These webinars are really built through our membership by people leaning in and telling us what's needed, and we'd love you to be part of the movement. So if you're not already a member, do check out our website and do become one. So now let's focus on today's webinar. I mentioned the series is called Health Management in Action, Fostering Health System Resilience. And we discuss topics like health management that are crucial to improve systems preparedness and responses. And really today's webinar is going to focus on, we know we want to do better resilient health systems, but how do we do that? How do we ask the right questions and research the right things in order to move forward in the right ways? And that's how we came up with today's topic. Practically, I think you'll all be familiar with these things, and we do record it and we make everything available on our website. So if you miss any of the key points, you can check them out on our website. And if you are someone who tweets, then do hashtag Emma webinars. So let's get to the crux of the presentation. We will have a 20-minute presentation, and then at the end we've got 15 minutes of Q&A that will follow. And if we can move to me introducing Lucy Morgan, it's really a pleasure to have you come and present with us. Like when we were discussing these questions of how do we ask the right questions, and really your insights and your thinking on that is very impressive. You're the Associate Director of Research and Policy at the Health Policy Partnership in the United Kingdom, and you're about to impart some of your great knowledge with us. Thanks for joining us.
Thanks so much, George. Absolutely no pressure with that introduction, but it's an absolute pleasure to be here. And yeah, I'm really looking forward to talking about assessment frameworks and kind of the crucial role that they can play in driving system readiness. If you want to go to the next slide, please. What I'll be talking about today is sort of an introduction to why readiness assessment frameworks, what they are and why they can be helpful. I want to talk through a brief case study to sort of show how they can be useful through the readiness assessment framework that we've developed here at the Health Policy Partnership. And then I'll provide some key lessons learned. We focused our readiness assessment framework on, being implementable and making sure that we could go to action, from research to action. And we've had some really, really core learnings there that I'm excited to share. If you could go to the next slide. So, why a readiness assessment framework? And I guess as part of that, what is health system readiness? If you want to go to the next slide, I think it's clear to all of us that health systems are changing and they're dealing with new pressures, right? We've got COVID, we've got climate change, we've got financial struggles, we've got an aging population, and all of these things are presenting new challenges to our health systems, to the way they work. And there are solutions to these challenges, or at least some solutions to some of them. There's evolving evidence bases, there's suggested new ways of working, suggested new diagnostics, new therapies, new ways of using existing treatments, existing modalities, new ways of measuring success, new ways of measuring outcomes. And while all of these potential solutions are fantastic, they're only fantastic if they are actually implemented into the health system. So when we're talking about health system readiness, we need to be ready to integrate these new components of care. If you want to go to the next slide. What I mean by readiness then is the ability of the health system to rapidly and sustainably adapt its policies, its processes, and its infrastructure to support integration of a component of care or way of working. Basically to react to that evolving evidence base, to react to external changes and make sure that we can keep up with that and continue to provide core services as well as new services to help overcome some of the barriers. And you'll see within that definition the term integration. And I do just want to define that because that's almost the crux of this issue for me, is that when we're thinking about getting ready for the future, getting ready to deal with new challenges and integrate new components of care, we need to be thinking at a deep level. We can't just be thinking about surface level availability. We need to be thinking about the ability to adopt and assimilate the component of care or the way of working, the innovation or the evolving evidence into every aspect of the health system. Because I think if it's not really truly integrated, then it won't be available to the people who need it, to the people who would benefit from it. So those are the core definitions that I'm working from, and I think the reasons why readiness can be so important. Do you want to go to the next slide, please? And so where do assessment frameworks come into this? Why are we talking about assessment frameworks? And the linchpin of that is that I believe that this readiness needs to be built on data. We need to have and be able to generate good data about the existing situation and understand what we want the situation to be in order to make realistic policy, in order to make effective policy. So readiness assessment frameworks and assessment frameworks in general help us do that by helping us identify barriers for integration. And they do that by helping us, then once we have an understanding of the situation, we can develop policy recommendations. So once we have that foundation of data, we can turn and say what needs to change. And finally, assessment frameworks help us by allowing us to compare the situation in different countries or different regions or different health systems. By having a sort of standard assessment framework, we can then have learning shared between these different areas, which effectively means that we can work more efficiently, right? We're not reinventing the wheel every time because we actually have a basis and a shared sort of metric for understanding how we're doing. So that's the value and the benefit from my side of an assessment framework. There are many others, but that's a sort of an overview. If you want to go on to the next slide. Effectively, readiness assessment frameworks, as I say, they allow us to measure readiness, and we need good data to be able to build this readiness, right? We can't just be going forwards sort of blindly. The risk of failure is too high, and I think it's a risk that at this stage we can't take. But data is only as good as the methodology used to collect it. And so one of the things that we've done is looked at a whole bunch of different readiness assessment frameworks and different assessment frameworks and said, what are the core components that make them valuable, that mean that they can achieve those objectives that I set out on the last slide? And I'll just run through them here. It's really important that assessment frameworks have a clear aim and objective and target audience, that it's clearly defined within the framework, what it is trying to achieve, and that is used to inform the entire framework itself. It's important that frameworks have relevant questions at varying levels of specificity, right? Overarching questions, big picture questions, as well as granular questions. It's really important that assessment frameworks are feasible. I think we've all probably clicked on a survey link at some point and seen 50 different questions and gone, well, I don't have time to answer this. When we're developing assessment frameworks, we need to make sure that they're targeted. They're getting at, what really needs to be measured, but also make sure that they are covering enough that they're useful and that the questions within the assessment frameworks are credible, that they're unbiased, and that they can be viewed sort of appropriately. I think with all data generation, we need to be mindful of limitations. So I think assessment frameworks can't exist in isolation. They can't exist as just a framework in and of itself. They need context, transparent explanation of potential limitations, right? This is where the framework is meant to be used, and this is where it shouldn't be used. That can help prevent people picking up the framework and applying it inappropriately. But finally, and most crucially, I think we need to be developing assessment frameworks that encourage next steps, that mean that the framework isn't just going to be sat on a shelf, that the research that results from it isn't just going to sit on a shelf. We need frameworks that encourage people to say, okay, so what? And now what do I do with this? Because really, if we're just doing research and we're not thinking about how to implement it and we're not thinking about how to make change, why are we doing the research, right? There needs to be that tangible next step. And effectively, I think readiness assessment frameworks, when done in the right way, ensure that we are collecting the appropriate data. And by having this shared metric, we can increase the efficiency of collecting that data because you're not having to go from step one every single time. People in countries around the world looking at different developments, different components of care, can all start from the same basis rather than going back to square one every single time. If you want to go to the next slide, please. I think in saying all this, there are a lot of metrics out there. Many of you will be aware of assessment tools, metrics to measure change, etc. And I think that they are all valuable. All these metrics have a place, right? When we're asking, what is bed capacity? That is a useful thing. We do need to know that. When we're talking about, do we have appropriate workforce? That's something that is important that we need to consider. But what I want to argue and maybe highlight is that any of those one metrics won't give you an answer. They won't help you prepare for future readiness. They won't give you an accurate understanding of health system resilience. And what I mean by that is saying we have enough beds, that doesn't matter if there isn't the workforce to support the people in those beds. And even if we have beds and workforce, that doesn't matter if we don't have, or if we have regulation that doesn't permit certain clinically beneficial ways of working. And none of that matters if we don't have data to inform regulations and if we don't have clear governance coming down saying, giving guidance, giving direction. And then ultimately, even if we've got regulations in place, even if we've got sort of governance suggesting that we should be moving in the direction of readiness, even if we've got appropriate service delivery, appropriate infrastructure, if service providers and people using care aren't aware of the services available, then again, ultimately, we're not ready. So this diagram here shows 5 core domains of the health system: governance, regulation and reimbursement, identified need, service provision, and health information. And I want to argue that when we are using assessment frameworks, when we're assessing resilience and assessing readiness and preparing, we need to make sure that we are looking at the entire system because nothing operates in isolation. And we can't get an accurate understanding if we don't look at everything together. If you want to go to the next slide, please. So as a case study of this, I'm going to talk through a readiness assessment framework that we have developed at the Health Policy Partnership. If you want to go to the next slide, please. By way of background, the framework was built around the World Health Organization's essential health system building blocks. Those of you familiar with the WHO building blocks will be aware there are 6. because the framework was built to assess readiness for a novel component of care, that aspect is not included. And so there's 5 domains, but they are the 5 other domains that represent the WHO building blocks. And the framework was developed based on a narrative review of the literature and with interviews from experts. And it was also guided by a multidisciplinary expert advisory group who provided a diverse range of perspectives on various different aspects of the health system. And within that, I include patient advocates, I'm including healthcare providers, as well as individuals involved in various different regulatory bodies. Though honestly, there was overlap between the healthcare professionals and those involved in regulatory bodies. And I think it's important to get that multidisciplinary and multi-stakeholder perspective. It was important to make sure that the framework could actually represent those different views. And finally, and I'll come to this a bit more later on in this discussion, but the framework was first applied in a specific new area of treatment known as radioligand therapy. And what we've done after making this specific framework for radioligand therapy, we've then gone away and applied it and made it more generic, So made it more broadly applicable and taken a step back and said, okay, what core aspects do we need to be considering for readiness more generally? So that's the methodology that we used overall for the readiness assessment framework. If you want to go to the next slide, thank you. I've been talking about frameworks. I've been saying that word, and framework can mean anything, right? It's a broad structure within which different things fit. It feels a bit like a buzzword because I've said it so many times. So what is a framework? When I'm talking about this framework, I mean a series of questions that we have divided into each of those domains of the health system. And this framework in particular includes qualitative and quantitative questions, and it's broken down from super broad questions all the way to really granular questions. So you can see on the right-hand side of your screen, there's an overarching question 1.1.1. Is there any national or regional cancer strategy or plan that includes or could include radioligand therapy? And this is broken then down into, say, how a therapeutic approach is considered. Is radioligand therapy included? It gets that little bit granular, and then you can work back up from those granular questions to say, okay, how ready is the system? I do want to specifically pause and say the readiness assessment framework that I'm talking about today is it's not intended to provide a metric, a number score for countries or regions or health systems to measure themselves on a sort of scale. It's more a qualitative output, a gap analysis of sorts. And then that qualitative data can be compared, but there isn't, say, a get to the green level, because I think that means that you're prioritizing potentially some areas of the health system above others. And that, to be honest, just doesn't feel appropriate given the holistic approach. So that image that you can see on the right shows some of the questions in the framework for radioligand therapy and hopefully provides a bit more of an understanding of what I mean when I'm talking about a framework. If you want to go to the next slide. And I think the reason that I've given this example of radioligand therapy and the reason that I'm talking about specific applications of a readiness assessment framework is because we do need a universal assessment tool, right? We do need a tool that can be adapted and applied to different situations. But each new component of care that we're considering, each different way of working, does have different specific requirements. So in talking about radioligand therapy, we need to think about readiness for radioactive waste. Is there enough capacity for radioactive waste disposal? But if we're talking about integrating, for example, a new multidisciplinary care structure, we probably don't need to be thinking about waste disposal, or at least not in the same way as we would with radioligand therapy. So the benefit of the generic framework is that it can be adapted and narrowed down. And it does need to be adapted and narrowed down to make sure that you really are getting at the details that are important for understanding readiness on all levels. If you want to go to the next slide, please. So in terms of what this tangibly meant for radioligand therapy is every single aspect of the work we've done, every aspect of the readiness assessment framework that we've worked on has been evidence-based. And I'm sure you're all well on board with the idea that evidence-based policy is more likely to be effective. It's more likely to be relevant, it's good value for money, and ideally it will have better outputs. So in developing this assessment framework, we took that approach. We did an initial round of scoping research and developed an entire policy report, which then formed the basis for the readiness assessment framework. And then we iteratively adapted the framework. I think it's important to always go back to your research questions and make sure that they are appropriate for the space you're working in. So as we took the radioligand therapy readiness assessment framework and applied it in the UK and the US, we went back and revised our international framework and said, are we asking the right questions to get the answers we want? Is the situation really what we thought it was? And these were relatively minor tweaks, but it is just worth, making sure that the tool you're using stays fit for purpose. And then lastly, and I think this is really important, is that we moved on to policy. We moved on to action. We took all this background research and we said, okay, this is the situation now. Based on this in-depth work, this is what we know the situation to be. And this is the next step encouraged within the readiness assessment framework to say, now what? What needs to change to overcome these barriers? And we worked with this multidisciplinary group of experts to help identify these barriers and then to help suggest solutions to overcome them. And I want to pull on that specifically in the case of radioligand therapy and in the UK, if you could go to the next slide. What you can see on this slide, and I appreciate it's a lot of text, is the 6 barriers that we identified in the UK, and then the policy recommendations that we developed for one barrier. And I'm not going to go into depth about these recommendations because what's actually important is the process through which we did this, which is that we had workshops with these expert advisors who'd been involved in the project. They reviewed the situation analysis, they confirmed that it met with their understanding of the situation. And then they helped us refine those barriers and refine the priorities within each of those barriers and say, well, yes, we're lacking professional training and licensing. And actually one of the big issues is that the Administration of Radioactive Substances Advisory Committee, or RSAC, some of their policies might need a bit of updating just to help us keep up because we're lacking some of these requirements. So they really helped their understanding of the health system in collaboration with our research and helped develop these clear recommendations. And as you'll see within them, each policy recommendation has a clear ask of a clear person, which I think is crucial, right? If we're implementing change, it can be really easy. And I'm sure we've all sat in a meeting where someone says, great, we need to do this. And then everyone sits there. If we don't call on specific people, then we may not be able to effectively make change. So that is the process that we took for developing specific policy recommendations for radioligand therapy, all the way from an initial readiness assessment framework and initial scoping research through to, okay, this is what needs to change, and let's make sure that we can implement it. If you want to go to the next slide. That has been a whole long process. That's been several years of work. And I don't think that readiness assessment frameworks and assessment frameworks need to take that much time. I think the benefit of actually having an assessment framework in place is that now that process can be done a lot faster because that first couple of years of work has been done and this assessment framework is there and it's ready to be used. But I think that there are some really core lessons that have been learned through this framework development, and I'm sure that others would say have been learned in their framework development. If you want to go to the next slide. The first one is to make sure that the outputs from the research can be used. We need to be engaging stakeholders at every step of the way, and that's when developing a framework, but it's really key when applying it too, right? It's asking the experts, and by experts, I do mean everyone who is involved in that system, sort of real life used and lived experience, to validate the research, to input into that research, to make sure that we are representing what they live, what they see, what they deal with day to day. It's engaging them in identifying the barriers and prioritizing those barriers. It's engaging stakeholders in helping to overcome those barriers. They might have insights and creative solutions that researchers haven't independently thought of. So getting a wide perspective of views can be hugely helpful. And it makes sure, again, that we're not researching just in this bubble. We're not preparing for future readiness in isolation. And then finally, I attended something recently and they were saying partnerships are crucial to any change. And I could not agree with that statement more. And I think anytime we go out and we try and implement change, we need to bring people along with us. So engaging different expert groups, different communities to enact the change recommended is crucial. And having them on board from day one makes it that much easier. If you want to go to the next slide. This is, I think, the crux of it all, and it's probably been said in other ways throughout. But if we don't know what we're measuring and we don't know what we're trying to achieve and we don't know how we're going to influence change, then we might just start measuring the wrong things. Effectively, what I mean by that is having the end goal in mind from the start will mean that the framework, adaptation, and application are all done in a way that supports change. They're all done in a way that means that when you get to the end and you have that data and you're going to the implementation phase, it's the right data to influence the right people in the most appropriate way. It's not data that's too complex to understand. It's not data that doesn't actually give an answer that you want. And I think we need to constantly just check in with ourselves as we're doing research and say, great, is this still aligned with the final objective? And that final objective does need to include how we engage and how we do actually influence change. Not just thinking about, okay, I want change, but how do I want to achieve change? Who do I want to engage? Because, say, for example, policymakers might be looking at data in a very different context to clinicians. And it's important to say, what kind of data do I need to present to whom and how? So if you want to go to the next slide, I'll just summarize with 2 key points, which is to say, really, I think assessment frameworks play a crucial role in building future readiness, but they are only as good as we make them. And so to ensure that they can be effectively implemented, they really need to be developed with multidisciplinary input and with the end goal in mind. So yeah, thank you all so much. And George, I'll hand back over to you, but hopefully I've lived up to expectations.
You sure have lived up to the expectations. Thanks so much, Lucy, for that comprehensive presentation. If we could get the slide second down now, and we'll go into Q&A. If you're in the audience and you have any questions, I'd encourage you to put your hand up, and you can switch on your microphone and ask away. Lucy, I'll start you off by saying one of the things that I was thinking is this seems very tailored and very specific and quite resource intensive.
Yes, I think that to get a solid assessment framework in place, you need to start with an investment. But I think that there are a huge number of tools now out there, including this one, that background investment shouldn't need to take place every time. Right, that's one of the benefits of the assessment framework, to say, here is a starting point. Go forward from here.
So is it then, what I was understanding was you're using your case study as a way to develop and build it, but then you could broadly apply that assessment framework to any other department. Is that what?
Yeah, exactly that. So saying here are the 5 areas, and here's questions within that go to the right level of granularity. Have a look at this. Consider that specific context for this component of care, this way of working, and adapt it as you need. But we've given you the basics.
Okay, great. Hi, Annalise.
Hi, how are you?
Good.
How are you all?
Good.
Nice to see you smiling again. I want to see your twinkling eyes again today. I'm seeing them. I'm seeing them. Sorry.
And yours too. So what's your question?
Yeah. what I was wondering, you want to achieve a generic approach to change, more or less, sort of, yeah? A change of policy, that is what you want to achieve.
To provide a generic approach, yeah.
Yeah, where Emma and you are part of the National Health Service. You're in the UK, aren't you, or not?
We are in the UK. We're not part of the NHS.
Yeah. Well, yeah, what I'm thinking about is, do you have an advice to use your approach cross-culturally?
Yeah, absolutely.
Because the NHS is so special, and I thought your presentation was really good. It was more interesting than I expected. It made me think.
Thank you. Yeah, no, I am the generic framework was developed at an international level. So the expert advisors that input into it were from around Europe as well as the US. So when we then took it and applied it in the UK, we added specific terms, say referencing NICE or referencing specific NHS bodies. But at the overarching level, it is meant to be an international framework and meant to have that generic level. So the refinement process is, okay, what component of care? And okay, in this country, what little tweaks need to be made? And I'll give you a specific example there. As I say, we have this international level framework, and we applied it in the UK and the US. And in the US, one of the tweaks we made was how we referred to funding. Because in the US, they said the term reimbursement is confusing and it means something different. Let's talk about funding. So it's not massive shifts, but it's little nuances that make it applicable.
Oh yeah, okay. Well, thank you for that. Yeah, funding is something special.
Yes.
Do you have some advice on that? But apart from that, yeah. So what if you're looking for a generic solution to change of the policy in whatever field, is finance the most riskful issue?
Well, rather, Annalise, I wonder if, because it's not necessarily a generic solution, is it? It's a generic methodology in order to...
whatever, yeah. It's different. I mean a methodology, yeah.
And what that actually has me thinking, Lucy, is it like the skills that are needed in order to undertake these assessments? Are we looking at skill building for people? I wonder also where the leadership comes from, and that for me would feed in, Annalise, to financing, because
exactly, yeah.
Are we financing in terms of staff capacity, staff training? So Lucy, maybe if you could start by saying, what is the skills that we need? Like if an organization wanted to go about using this, how would they do that capacity-wise?
So yeah, I think the core skills required are research skills, from ability to do a review of published literature, ability to interview experts, which I think those are transferable skills. And I think it starts from ground one, from my mind, right? Like that is skills that we should be embedding in students throughout education, so that they're lived and can be built to the point where when you're working in an organization, you can pick it up and run with it. One of the things, and I will say that we've done, is aim to help that process. So there's the readiness assessment framework, there's a comprehensive user guide, which outlines the methodology, and there's a video explaining the methodology a bit as well. So the aim is that it's easy to pick up and run with. Having said that, there are those base skills. And as you say, there is that leadership and governance. And I think we're not there yet in terms of having health system leaders that always understand the need for this change, that understand the need for these frameworks.
So how do we get there then?
My approach is small incremental steps, one at a time, coming together, raising the profile. I actually think, I hate to say of positive things that have come from COVID, but it has put the importance of health system resilience more on the front page. And I think that is I don't like that there has to be a crisis to get to that point. but
Yeah.
crises do prompt more rapid change.
Yeah, okay. There's a comment in the chat box, and Ayash Vandenberg, if you wanted to switch your camera on and felt comfortable to ask in person, I'd encourage that. Otherwise,
That's me.
Oh, Annalise, honestly, gosh, because you don't have your name typed out. I'm glad that's been the case. So,
You want Trinkley guys?
oh, Annalise, you've got all the bases covered, haven't you?
Well, no, and it sounds I was about about the cross-cultural thing. Sounds of the use of Delphi research method. Is that correct?
We didn't specifically use that method, no. We were informed by a variety of different methods, and we generally drew our approach from grounded theory. But yeah, sort of aware of, but didn't strictly follow that method.
Lucy, my other question is around what did you, because you work across all of Europe, and have you observed the use of any type of framework comparable to this? Are there any places that you've seen engage? And I'd also turn to the audience. If anyone in the audience is using assessment frameworks in this way, or has an experience or an interest, we'd love to hear from you. Lucy, maybe if we start with you while we wait for the others in the audience.
Yeah, so in this research, we definitely found there are other frameworks out there, and I give a shout out to there's the POSIT assessment tool, there's the WHO-SARA framework, amongst others, and I think they are picked up and applied in different ways and in different places. So I do think there's growing recognition of the need for these and growing use, but yeah, I'd love to hear examples of other people having implemented these, because I think because it's a process and because it takes time, the more data that we can generate about their value and their use, the better.
Mm-hmm. Yeah, okay. If there's anyone in the audience who do have any example to say, maybe you could even just put your hand up to indicate that that you've got that you've seen it being used in your setting. That would be really helpful to have that indication. Lucy, I also wondered about if this is a shift in governance. Oh, I see a camera activated. Katarina, was that you wanting to come in with a question?
No, thank you.
Okay. Well, thanks for being with us anyway. Lucy, I wonder then around, because we talked about, how do health systems then better prepare for this? And it sounds like a governance shift, and that as these assessment tools are being used more in different departments or different areas, that ultimately this builds a different approach to how planning is done. Am I understanding that right from what you're saying?
Yeah, you've summarized it much better than I was saying. I do think it's a slow and incremental process, and I think, as I say, I don't think we're there yet, but I think there is more of a recognition of the need for evidence-based policy, because we need to be careful about how we are planning and how we are preparing, because we do have limited resources and a lot of new challenges. And I think, to be honest, and this is more of a personal philosophy at this point, but I think that we need to have time, and we need policymakers that have time to take that step back and say, okay, there is a panic going on. Let me take a step back and get out of that and look at it with a bigger perspective.
Yeah, I mean that resonates, I think, with everyone. I think the challenge is, how do we get people to have time? And for me, that's what I'm seeing as a big challenge, that people would do. I think people would dream of doing more work like this. They know they need time, but how do we get the time? But also that's a struggle we've had for decades, not just from COVID, that we know we have to choose our time very carefully, and that's investing in strategic decisions gives us efficiencies later down the line. But it's that breaking point. And actually, Martina has a great question. Martina, would you like to ask that live? Otherwise, we can just read it out. I see your microphone's open, Martina. But I don't hear her. Does anyone hear her? No, okay. Martina, we can't hear you, so I'll read it out, but thanks for asking your question of, did you identify some main pillars or key factors that would support or sustain resilience of a European health system to a future health crisis?
All of them. That's not a helpful answer though, so let me try and break it down. I think Annalise mentioned funding, and I think
and here's Martina. Thanks for joining us, Martina.
Sorry, I had problems to join my microphone, but thank you for reading that question already aloud. So, okay.
Great, thanks to Lucy.
Yeah, I really think that it needs to be everything. It needs to be the whole system that gets ready. And I think it needs to be looking forward as well. Like, I think that's when we're talking about what are the main pillars that mean we are going to be resilient against potential future health crises. We need to have a strong base to be able to react. And I think that for me is the main pillar is what are we doing to strengthen the basic provision that we're giving to make sure that we aren't at a tipping point and we have that flexibility to adapt. And as I say, we are at that tipping point. As George says, we've been at that tipping point for decades. So how do we build back that core? And quite frankly, I think it needs a drastic rethink of how we do prioritize and the way that we think about health, and really accepting innovation, accepting possible innovations, and starting to prioritize wellness and prevention even more.
So I want to come back to Martina, but Lucy, so what I'm thinking is, I feel like what we're saying, and I feel this too, is we need something bigger, but we can't have something bigger because we're not ready for something bigger. So we have to do it in this increment until our governance systems are there. Is what I'm saying kind of, does that resonate with you, Martina? Is that basically what you're saying? Or tell me more about your perspective.
I think it's probably along those lines. If maybe in the European health systems, if some factors could be identified that we have in common, that we could also build on together, maybe have some kind of schedule, even if we can't have the bigger picture yet, but have an idea of it, or have a vision of it, that we can all, in a European way, work together to achieve.
Yeah. Yeah, that's the dream, isn't it? That's Lucy, is that the end point in mind that you have?
I think yes, not necessarily the ultimate end point, but that would be a step along the way. I think, and even things like Europe's Beating Cancer Plan are building in that direction, right? They're saying what can we do and how can we learn from each other, to go forward in one direction and support each other with this change. Yeah. And that's it, right? By measuring the same things, at least then we'll be on the same wavelength about what needs to change, and we can identify those priorities appropriately. If I can, George, come back to your point, it's a question of like, how do systems change, right? Like, are we going revolution or are we working from the inside out? And I won't engage with that, but it's a wider question.
Yeah, I'll engage with it. Yeah, yeah, indeed. So we're out of time. My colleague has put in the link to evaluation. As we ask every webinar, your comments really shape these webinars, giving us those ratings, feedback that we can share with the speakers, and that we can learn for our future webinars is actually so important. It takes less time than I've told you to fill in the survey to actually fill in the survey. So please do that. Oh, Gabby, great that you joined us. Thank you. Thanks for being here. Please do fill that out. And I thank you all for attending and for engaging. It's great to have you with us. And Lucy, it's been really a fantastic presentation. It'll be recorded and the slides put up on the website. And I'm sure that you've learned as much from these discussions that will inform your future work as we have from you. Thanks for being here.
Thank you so much, George. It's been fantastic. And thanks so much, everyone, for your questions as well.
So on our next webinar, there was a slide just up now that says that one's coming up on Tuesday, the 11th of October. Like all of them, we try to make them bite-sized just after lunch. And this one will be on integration with Dr. Axel Kani, who was the previous president of EMA, and with Mr. Stacey Yemenos, who's the Executive Director of Eurocarers Belgium. So it would be great for you to join us for that as well. Get it in your diary and register, and we'll see you there. Many thanks. Take care.